If you got sick in ancient Rome, there was a good chance the doctor who showed up at your door had never studied a single body in his life. No x-rays, no antibiotics, no idea germs even existed. Just a knife, some herbs, and a lot of confidence. And yet, Rome built an empire of 60 million people. Aqueducts, roads, cities with over 1 million residents. So the real question isn't just how they survived without modern medicine. It's how they survived some of what passed for medicine in the first place. Here's the thing people don't expect. Romans weren't idiots. A lot of what kept them alive wasn't medicine at all. It was infrastructure. Rome built the Cloaca Maxima, one of the world's first major sewer systems, and ran fresh water into cities through aqueducts that could stretch over 50 miles. They didn't know about bacteria. They just knew that dirty water made people sick, and clean water didn't. So they engineered clean water at a massive scale, centuries before anyone understood why it worked. Public bathhouses weren't just a luxury. They were, unintentionally, a public health system. Romans didn't have soap the way we do, so they'd rub themselves with oil and scrape it off with a curved tool called a strigil, taking dirt and bacteria with it. Multiply that by the millions of Romans who bathed daily, and you've got a population that was, by accident, far cleaner than most of the ancient world. The military took hygiene further. Roman army camps had dedicated valetudinaria, field hospitals, with separate wards, drainage, and staff whose entire job was wound care. Archaeologists have found surgical tools so precise that some designs were still in use in the 1800s. Scalpels, forceps, bone saws, even early catheters. And soldiers cleaned wounds with vinegar and wine, both mildly antiseptic. They had no concept of infection as we understand it. They just noticed. Wounds cleaned. This way killed fewer men, so they kept doing it. This is the pattern you'll see throughout this whole video. Rome survived less because they understood why things worked, and more because they were relentless, brutal observers of what worked, even when their explanation for it was completely wrong. So, what did Roman doctors actually believe was making you sick? Almost everything came back to one idea, borrowed from the Greeks. The body was run by 4 fluids: blood, phlegm, yellow bile, and black bile, called the 4 humors. Sick meant these fluids were out of balance. Every treatment was really just an attempt to rebalance them. Too much blood, bleed the patient. Too much phlegm, induce vomiting. Feeling depressed, that was literally black bile, which is where we get the word melancholy. Bloodletting was genuinely one of the most common medical treatments in the Roman world for almost any ailment: fevers, headaches, even mental illness. Doctors would open a vein and drain blood by the cupful, believing it released whatever was making you sick. It usually didn't. Sometimes it killed people faster, but because Romans had no other framework for disease, this theory held for over 1,000 years. Some doctors were still bloodletting patients well into the 1800s. Diagnosis itself was mostly guesswork dressed up as science. Doctors would check your pulse, examine your urine, and ask about your diet and mood, then match your symptoms to whichever humor seemed most out of balance. There was no test to confirm any of it. If the treatment didn't work, the explanation was simply that they hadn't rebalanced you correctly yet. Never that the theory itself might be wrong. If one person shaped Roman medicine more than anyone else, it was a Greek doctor named Galen, who treated Roman gladiators and eventually became physician to the emperor himself. Galen got his start patching up gladiators in Pergamon, which meant he saw more traumatic wounds, torn muscle, and open injuries than almost any doctor of his era. He called gladiator wounds windows into the body because they let him observe human anatomy without ever needing to cut someone open himself. Rome had a strict taboo against dissecting human bodies, so Galen dissected animals instead. pigs, goats, and especially Barbary macaques, because their anatomy was close enough to a human's to teach him real lessons about muscles, nerves, and blood flow. The problem? Animal anatomy isn't identical to human anatomy. Galen made real discoveries, but he also made real mistakes, and because his authority was so total, almost nobody questioned his work for the next 1,400 years. Doctors in medieval Europe were still treating Galen's writings as final medical truth, more than a millennium after he died. If you walked into a Roman pharmacy, you wouldn't find pills, you'd find a shelf of plants, animal parts, and minerals, and a doctor deciding your treatment on the spot. Willow bark, chewed for pain and fever. It actually contains a compound related to aspirin, so this one genuinely worked. Honey, packed directly onto open wounds. Honey is naturally antibacterial, so this wasn't superstition. It measurably reduced infection, even though nobody knew why. Then there were the treatments that were less effective. Crushed beetles for toothaches, goat dung for various ailments, boar's urine, believed to cure bladder problems. Mercury and lead were both used medicinally, and both were slowly poisoning the people taking them. Lead, in particular, was everywhere, not just in medicine, but in cookware, water pipes, and even wine, which Romans sometimes sweetened by boiling it in lead pots. Some historians think chronic lead poisoning may have quietly affected the health of the Roman elite for generations, without a single person alive knowing the cause. The uncomfortable truth is Roman medicine was a coin flip. Some remedies, discovered through centuries of trial and error, genuinely worked. Others were actively making people sicker, and there was no way for a Roman patient to tell the difference between the two. This is the part most people can't imagine. Roman surgeons performed real operations, amputations, cataract removal, even a version of a C-section, completely conscious with no real pain relief. Some doctors used opium or mandrake root to dull pain, and there's evidence of a sleep sponge, soaked in a mix of herbs and held over the patient's face. But dosing was guesswork. Too little, and you felt everything. Too much, and you might never wake up. Given those odds, many patients chose to just be held down and endure it. Survival often came down to speed. A skilled Roman surgeon could complete an amputation in under a minute, because the faster it was over, the better your odds of surviving the shock. Nowhere was the gap between surviving and modern medicine wider than childbirth. Roman women gave birth sitting upright in a special birthing chair, assisted by a midwife rather than a doctor. Midwifery was one of the few medical roles almost entirely run by women. Some midwives were skilled and experienced, passing down real practical knowledge about labor and delivery through generations. But without antiseptics, safe ways to manage bleeding, or any understanding of infection, childbirth killed a staggering number of Roman women. Some estimates suggest it was among the leading causes of death for women of childbearing age in the ancient world. A difficult birth that would be a routine emergency C-section today was often simply fatal. For the mother, the child, or both, this is part of why average Roman life expectancy is misleading. It's often quoted as around 25 to 30 years, but that number is dragged down heavily by how many people died in infancy or childbirth. If you survived to adulthood, your odds of living into your 50s or 60s were far better than that statistic suggests. For everything Rome got right by accident, there was no answer for a true epidemic. The Antonine Plague, likely smallpox or measles, tore through the empire starting around 165 AD, brought home by soldiers returning from campaign. It's estimated to have killed 5 million people or more, possibly including an emperor himself. Doctors had no idea what caused it, no way to treat it, and no way to stop its spread. Their entire medical framework, the 4 humors, bloodletting, herbal remedies, simply had nothing to offer against a disease like this. Some Romans turned to religion instead of medicine entirely, praying at temples of Asclepius, the god of healing, sleeping in his temples overnight in hopes of a dream cure, or performing sacrifices to try to explain a disease no one could see or understand. When your medicine can't explain what's killing you, faith becomes the only remaining tool. Here's the part that gets left out. Medicine in Rome wasn't equal. If you were wealthy, you had a personal physician, often a Greek slave or freedman, trained in real anatomical knowledge. Some of the best doctors in the empire were legally someone's property. If you were poor, your options were far worse: a traveling healer, a temple priest, or nothing at all. Roman soldiers, ironically, often had better organized medical care than most civilians, because a healthy army was a military priority in a way that a healthy peasant simply wasn't. Survival in ancient Rome wasn't just about medical knowledge. It was about who could afford access to it. So, how did Romans survive without modern medicine? Mostly the same way any of us would, by getting lucky, by relying on a body's own ability to heal, and by holding on to a handful of remedies that happened to work, hidden inside a system that mostly didn't understand why. They built empires on clean water and battlefield surgery, and they nearly killed people with bloodletting and lead cups. Both of those things were true in the same century, sometimes in the same household.